Welcome to the Nursing Post podcast, all nursing all the time, with Ashley Moore and Rosa Horsley. To honor Autism Awareness Month in April, we will explore Autism Spectrum Disorder.
This topic is near and dear to my heart as my son is on the spectrum. My hope is that this podcast subject will be an informative mini-series for patients, parents, family, and healthcare workers to educate, to help those with ASD, and to start conversation. My goal is inclusion and acceptance. 1 in 59 children in the United States have autism spectrum disorder, according to the Center of Disease Control and Autism and Developmental Disabilities Monitoring Network. ASD occurs in all races, cultures, and socioeconomic groups. 1 in 37 boys are diagnosed. It's more prevalent in boys than girls, and boys are 4 times more likely to be diagnosed. 1 in 151 girls are diagnosed.
So I just read an article in a autism magazine that stated that girls are not being diagnosed because it's being missed. They don't know that actually those numbers are that there's that big of a gap.
Yeah.
That it's more likely that the girls are just not being diagnosed.
Well, you can't diagnose something that you're not even screening for.
Right.
So you're going to miss a lot if you're not even looking for it.
Mm-hmm.
The CDC defines autism spectrum disorder as a developmental disability that can cause significant social, communication, and behavioral changes. Each person with autism has a distinct set of strengths and challenges. Autism is classified on a spectrum, and what that means is that it's a range of linked conditions, sometimes also extending to include singular symptoms and traits. So on the spectrum, there's mild, which means you have strengths because you need less support and you can function entirely independently.
Mm-hmm.
And there is severe autism, which has more challenges because these patients need a significant amount of support and assistance.
And what we know for causes of autism, in my opinion, is steadily growing. We don't really know a lot about it. We do know it's hereditary. It does run in families. If a congenital twin is diagnosed with autism, there's an 80% chance that the other twin will be diagnosed. This is with identical twins. It's a 40% chance of diagnosis if the twins are fraternal. There are 65 genes that they consider to be strongly linked to autism, but there are more than 200 others that have weaker ties. Many of these genes are important for communication between the neurons, which is what helps control the expression genes. Autism is also associated with other genetic disorders like Rett's or Fragile X. And for other children, there may be genetic mutations, but this is more of a risk factor. And just because they have the genetic mutation does not necessarily mean that they have autism. So there's a little bit of a difference there.
Correct.
Just because they have it doesn't mean that. Just because they have the genetic mutation does not mean they have autism.
So in nursing, that's being a carrier.
Right. And there are a couple of environmental factors. Parents' age. So if you have kids later in life, your child is more likely to have autism. Birth complication, and we're looking at premature births, and that is births that occur prior than 26 weeks, which is very, very premature. And then other environmental factors really just haven't been identified. Those are the 2 main ones that we know. And non-genetic factors contribute to 40% of autism risk.
So let's bust some myths here.
Oh boy.
Vaccines.
Yes.
There is no link between vaccinations and autism. And this is so important that I'm going to say it twice, just in case you missed it the first time. There is no link between vaccinations and autism. A study done in 2011 by an Institute of Medicine studied 8 vaccines given to children and adults and found, with rare exceptions, these vaccines are very safe.
Mm-hmm.
In 2013, the CDC added to the research showing that vaccines do not cause autism.
Which I would like to say, there is a lot that goes into performing these studies. There is a lot of manpower and money. and we are spending a lot of that time going over the same information time and time again.
Because of false reports, false studies that have been reversed.
Right.
The original study that ignited this debate years ago has been retracted due to poor design and questionable research methods. So I just learned today that the person who published this research was not even an MD.
Which, that in itself would tell a lot of people that study is not even
credible.
Right.
It's not a credible study.
No.
There was no scientific method used to determine this. So it ended up being retracted. And then research also shows that thimerosal does not cause autism. So in 1999 and 2001, thimerosal was removed or reduced to trace amounts in all childhood vaccines, except for flu vaccines. This was done as part of a broader national effort to reduce all types of mercury exposure in children before studies were conducted that determined that thimerosal wasn't even harmful. So this was precautionary because of the retracted study.
Right. And that's a preservative that you find in the multi-dose vials to help with bacteria growth.
Yes, it's a preservative. Its job is to keep the vaccine.
Right.
Once again, thimerosal is not linked to autism. Vaccinations are not linked to autism. And this is extremely important as there are so many people that are refusing to vaccinate their children.
Right. Just for fear that their child will get autism. And now we're seeing an influx in the United States in these
eradicated or formerly eradicated diseases, such as measles, mumps, and rubella.
Right. And so we have a way to prevent it from ever coming, and we're not doing that. And now this is resurfacing again.
There is no cure for autism. And some of the other myths that are out there are about dietary changes. So people are removing dairy from diets. They're removing gluten from diets, thinking that this is going to cure their children's autism, or they're going strictly organic. And there are no studies that show that this is credible.
And the other thing that I had read, which completely...
It's mind-blowing.
It really baffled me. I actually had to pause and make a phone call and say, I can't believe this is ridiculous, is bleach and other chemicals, they're not going to cure autism. Don't have your child or your patient drink them. It won't work. I don't think that anybody would make a nurse would never have a patient drink it, but they need to make sure that they're educating.
I think somebody
the
has.
caregivers. Yes. Oh, somebody's done
Somebody's
it.
done
Without a doubt. But I just couldn't believe that was actually written in an article here recently that bleach does not cure autism. Like, who would have thought that it would have? No.
It doesn't make sense. It just doesn't make sense.
So one of the questions that a lot of parents have is when should I be concerned? And there are a couple of things that you can look out for. Most kids show signs of delayed development before age of 2. And that is really important because the earlier the diagnosis is made, the better. So a couple of things to look out for. Doesn't respond with a happy expression or a smile by 6 months of age. They don't mimic sounds or facial expression by 9 months. They do not babble or coo by 12 months. They don't gesture, like point or wave at something by 14 months. They don't say a single word by 16 months. So we're thinking basic mom, dad kind of words they should be saying by 16 months. They don't make believe or pretend play by 18 months, or doesn't say 2-word phrases like want juice by 24 months. One of the biggest things that you need to look out for that a lot of people talk about is their child is developing at a completely normal rate, is doing all these
all
things.
The milestones.
So, and then all of a sudden it goes away. And that's a huge red flag. So if that occurs, then that's an automatic, we need to screen for autism.
That happened in retrospect because hindsight is always 20/20. Looking back, that's exactly what happened with my son.
Right.
He was hitting all the milestones and then he couldn't even put sentences together, or he just stopped, putting sentences together. They were one-worded instead of the two-word sentences or phrases.
Right, and a good rule of thumb that we follow in nursing is by 2 years old, 2-word sentences. By 3 years old, 3-word sentences. And that's kind of an easy way to remember that. And if your patient or child is not meeting those goals, then there is delayed speech and there are other things, but when you start putting things together, then it starts making more sense.
Yes, when you have all the pieces of the puzzle, they tend to fit.
Right. I like that.
Risk factors, your child's sex, as we talked about in the beginning, that boys are more prevalent and they are more often diagnosed. Family history, so if your mother, father, brother, sister, or cousin has autism, then your child is at a higher risk. Other disorders, Rett syndrome that we talked about, fragile X factor, being a premature baby that was birthed sooner than the 26 weeks, and as we also discussed, older parents, and that not only happens in autism, but other genetic factors as well, like Down syndrome is more prevalent.
Right.
The older that you get, or the longer you decide to wait to have children.
Well, it's a higher risk pregnancy at that point.
Yes,
as well.
Absolutely. So some signs and symptoms that usually show of delayed development or regression before the age of 2 years old. And even though we hit some of the major, milestones, these are some more in-depth signs and symptoms to look out for every day.
Right. Well, previously that was kind of more 18 to 24 months and younger. And this one kind of expands a little bit beyond that.
It does. It does. So social interaction and communication, fails to respond to his or her name, resists cuddling and holding. They prefer playing alone. They kind of retreat into their own world. Has poor eye contact or lacks facial expressions. They don't necessarily show any excitement. They're pretty apathetic. They have flat affect. That's what we call it in nursing, a flat affect. Doesn't speak or has delayed speech or loses the previous ability to say words and sentences. They can't start a conversation or keep one going. And when they do, it's only to make a request or to label items. They speak with an abnormal tone or rhythm and may use a singy, songy voice or a robot-like speech. So they're very rhythmic or they're very monotone.
Right. And it doesn't usually go between the two. They're one or the other.
Yeah.
Some other things that you can look out for if they repeat words or phrases verbatim, but does not understand how to use them. So if they say there's more than one way to skin a cat, but they're really not using that in the proper...
They're taking it literal.
There's
more than one way to actually skin the cat.
Right. And so they're not looking at it, there's 2 ways to solve this problem. They don't appear to understand simple questions or directions, which is something like giving them 3-step process to do. They can't do that. It's one thing at a time. They don't express emotion or feelings, and they appear unaware of other people's feelings, like, I didn't see that you were sitting there upset.
They lack empathy.
Right. They don't point to objects and bring them to you, like color a picture and say, look at what I drew kind of situation. They inappropriately approach social interactions by being passive, aggressive, or disruptive. They have difficulty recognizing nonverbal cues or interpreting other people's facial expressions or their body language or their tone of voice. They have patterns of behavior, like they repeat certain movements such as rocking, spinning, hand flapping. If they do things that could cause self-harm, such as biting themselves even, or headbanging.
They develop specific routines or rituals, and they become disturbed at the slightest change. So if my son has an appointment on Friday, trust and believe I'm telling him Monday, we have an appointment on Friday. Tuesday, we're saying it again. Wednesday, we're saying it again. Thursday, we're saying it again. And Friday morning, we're saying it again, so that he knows that this is a change in their schedule.
And if that appointment gets canceled,
gotta tell him.
I mean, it's not, I forgot to tell you. You have to keep them informed.
has problems with coordination, which means they're kind of clumsy, they're walking on their toes, they have odd movement patterns, they're stiff or exaggerated body language, is fascinated by the details in an object, such as the spinning wheels of a car, but they're not really necessarily interested in the car itself.
Right.
Fidget spinners are very popular with autism kids because they spin and they glow in the dark, some of them, and they love that.
Right.
They love that motion.
Mm-hmm.
Doesn't engage in imitative or make-believe play. Fixates on an object or activity with abnormal intensity or focus. A lot of children love Legos.
Right. Well, and that's, again,
Yes.
a great activity that they can do by themselves.
Yes.
Build it. They don't need anybody else there. It kind of reinforces that same solitary kind of play.
Absolutely. Has specific food preferences, such as eating only a few foods or refusing foods with a certain texture. So maybe they just don't like mushy things. So they're not going to eat necessarily a mashed potato, but maybe they'll eat something that has a little more texture, like a shoestring French fry.
Right. And I don't have a child that's autistic, but I do have kids, and I am very much by the mentality, this is dinner. If you don't eat it now, when you get hungry, it'll be ready and available for you to eat.
And that doesn't work. I have 2 children, and only one of them's autistic. That worked for my first child. I'm telling you, that doesn't work for my second at all. He will not eat.
Right. And so that's where you have to understand the difference, that you just can't, when they get hungry, they'll eat.
No. Literally, they won't.
They won't.
They won't.
And that's something that you have to take into consideration when you have a child that's autistic, or if you're around somebody whose child is autistic and if they want something specific for dinner, eat that. It'll make everybody's life easier.
Absolutely. And his psychiatrist specifically states, whatever he will eat, give it to him. If he likes milkshakes, that has a lot of calories, give it to him, because they need to consume calories.
It has other things in it, and we live in a society where everything is enriched with other vitamins. So at this point, at least he's getting some calcium.
Absolutely.
And that's how you kind of have to look at it and try to
just build from it.
There you go.
You know, if he's the consistency of a milkshake, he's probably going to try a frozen smoothie, which is a healthier option.
Right.
So depending on his flavor choice, you could probably find a healthier alternative that's the same texture as...
Right, using frozen yogurt instead of ice cream or whatever. You have to make it work and hope that they try it.
And love it.
All at the same time. So some screenings that I had, this is another very interesting read that I had. Children should be screened at age 18 months and 24 months, period. That's according to the American Academy of Pediatrics. So no matter if your child is showing signs and symptoms or not, they should be screened.
Period.
Whether
they're male or female.
Right. It doesn't matter. Just all kids. They're all going to pass that age, hopefully, and they should be screened. And I think pediatricians are probably better about that. I would hope. I don't have the data to know that, but I do know I've had a child that saw primary care, and I've had a child that I saw a pediatrician. The appointments were vastly different. Not that either one of them, in my case, resulted in any kind of delayed diagnosis, but...
That's their field of specialty.
Right.
Let's be honest. Would you go to a brain surgeon for an ingrown toenail?
No.
Okay.
And the biggest thing that I want to kind of hit home with this is only about half of primary care physicians screen for autism. And primary care physicians see kids as wellness visits. They saw one of mine as a wellness visit just because, honestly, it was more convenient for me. My child was great, developing wonderfully, didn't have any issues. But if my child had issues, to realize that there's probably a 50% chance that they would not have been screened, that's crazy to me.
You would at least hope that they would have, one, you would hope that they would have screened. And two, if they were not meeting the milestone markers, you would hope that they were referred to a pediatric
But I mean,
physician.
That's a 50-50 shot.
It's a 50-50.
And in medicine, that's not good.
No. That's a 50% you're on the green side, or, 50% you're pushing up the daisies.
Right. So I don't really like that. No. And so what I want to say for this is, if you have a child, no matter who they're seeing and you have concern, know that at 18 to 24 months, they should be screening for this, and you can ask for that. And as nurses, if we're in a situation where the child doesn't seem to be responding appropriately, then you should say something to the provider. Hey.
Absolutely.
You need to look at this. I was in there. The child wasn't acting quite like every other child that comes in. And there's sometimes a very noticeable difference and sometimes not.
There's not. It's very
so that's
subtle.
where understanding and speaking to the family and the parents or the caretakers is really important.
Absolutely. So the second part of this where your child can be screened is actually in school. Schools have developmental pediatricians, they have child psychologists and psychiatrists, they have neuropsychologists and speech language pathologists that work with language, feeding, and social speech. Granted, these are usually services that are offered after you've made a referral for special education resources and have been approved.
Right.
But it's a good resource to have nonetheless because you can actually ask the school to test your child for any learning disabilities, and by law, they have to do it.
Right. It's just nice to know that these are available.
Mm-hmm.
So currently, the average age for diagnosis for autism is over 4 years old, and that's in the United States. Research has proven that the earlier the diagnosis is made, the better outcomes individuals will have. With increased awareness and advancements in the screenings, lowering the age of diagnosis would help improve an individual's outcome.
We will link our references on our website, www.thenursingpostpodcast.com, and be sure to subscribe to our podcast, and you can follow us on Facebook, Twitter, Instagram, and YouTube. Thanks for listening to The Nursing Post.